Hello and welcome to my dental hygiene school experience. My name is Dach Ska, and each episode I'm going to share my own experience of dental hygiene school. The highs, the lows, the funny, and the real. Thank you for joining me on my journey, and here's another episode right now. What's up, dental nerds? This is Dach Ska, and you're listening to my dental hygiene school experience. You know, it's been a bit since I've released an episode. I've been releasing a little bit more recently. I'm looking for people to interview for the show. Apparently, it's a lot harder to get in contact with people than I thought. Anyway, I am doing a few interviews and other episodes coming up. But today, I wanted to talk about myofunctional therapy. I'm going to be interviewing Kayla. She's from Prairieland Myofunctional Therapy. And she's going to talk about what myofunctional therapy is and a lot of details about it, like who it can benefit, what are the goals of myofunctional therapy, and much more. I know I've talked about it on the podcast a few times, but this is your deep dive to learn all about it. So without further ado, here's my interview with Kayla. Hi, Kayla.
Hello, how are you?
Good. How are you doing?
I'm good.
So, Kayla, you're a myofunctional therapist.
That's true. Mm-hmm.
I mean, that's pretty cool. Do you want to explain a little bit about what that is?
Yeah, so first and foremost, I am a registered dental hygienist. So I have been registered since 2016. I practiced in private practice for about 7 years. And after, the birth of my second child, there were some things that changed in my personal life, and I was kind of open to the world of myofunctional therapy. So then I went back into training to receive a certification in myofunctional therapy. So myofunctional therapy is basically a modality of treatment similar to physical therapy. We're just mostly targeting the muscles of the oral facial complex and the head and neck. So very targeted and specific.
Okay. That's really cool. I mentioned before on a previous episode of my podcast that in my head and neck anatomy class, very fitting, my instructor mentioned something about it. I'm like, wait, what was that? Like, what do you call that? I had to Google it right away because it was so fascinating just from the start for me. So
yes,
when I graduate and all that,
hardly
that's my
touched
future goal.
upon when I was in hygiene school. I think it was maybe mentioned for like 5 minutes or less, and it was made out to be like this hippie type of thing, and not really worth your time. So we didn't really know much about it at all. There was one hygienist in my state, like the whole state. There was only one provider, and they made her out to seem like this like kooky weirdo type of person, and that was that. So I never really looked into it at the time. So
yeah, I was reading a little bit about the history, and it actually goes quite a ways back, like a lot longer than people would expect.
Right.
But then I think there was, at one point, they're claiming it does all these things that it doesn't do at all. And so then it got discredited, and now it's making a comeback. And the more I learn about it, the more I see how beneficial it can be for people.
Mm-hmm. Yes.
So what are the goals in myofunctional therapy?
So the goals of myofunctional therapy are to, 1, create a functional nasal breathing pattern in and out through the nose all day and night, using muscles of the diaphragm versus the upper chest muscles. 2, we want to establish a proper oral rest posture with the tongue in light suction, tip, middle, and base up against the roof of the mouth all day and night, aside from eating and speaking. We want to create a proper chewing and swallowing pattern. We want to eliminate any sort of noxious habits that could be like thumb sucking, nail biting, those kinds of things. And we want to be able to do all of those things without any muscle compensations in the cheeks, neck, and shoulders. So
that's awesome.
Yeah.
And so what would prompt someone to seek out myofunctional therapy?
Oh gosh, there are so many things that correlate back to a myofunctional disorder. Typically, they are, either being referred to me by a dentist usually, so someone that maybe specializes in tethered oral tissue, so like a tongue type of situation. I get a lot of referrals for snoring, for mouth breathing, for clenching and grinding of teeth, for headaches, migraines. I also get some referrals for, I just talked about this today on my TikTok, sleepwalking and sleep talking. There's a lot of things that correlate back to poor airway function, which then goes hand in hand with that oral function, which is what I'm working on. So we need proper oral function to create airway patency, so getting those muscles inside the mouth in proper tone and function and in a proper position so that the airway remains open for nasal breathing. That is especially important at night. So.
Yeah, definitely. That's awesome. So I guess what interested you in myofunctional therapy to begin with?
Yeah, so I kind of got into this on a roundabout way. I have 2 children. My firstborn was, I was breastfed him with no problem for about 18 months. And then I had my secondborn who really struggled to breastfeed. And so after weeks and weeks of me taking her into the pediatrician and seeing our lactation consultant and them telling me that there was nothing wrong with her, that she was just going to be teeny tiny and it was normal for her to, have all the symptoms that she was dealing with. I knew that there was something that was not right about the way that she was latching and nursing. And, she was super fussy and gassy and she had lip blisters and she clicked when she nursed and she leaked out the corners of her mouth. There was just so many things that told me that there was something not right. At that point, I sought out a dentist who was trained in tethered oral tissues and just got an evaluation. I said, there's nothing that's going to hurt about just getting it evaluated if this is something that could help us. The dentist was a female. She diagnosed my daughter with a pretty significant tongue tie and a lip tie as well. I did go ahead and have both of them released, so her lip and her tongue, and it made an immediate difference, which after that happened, her pediatrician was like, oh, it's probably just a coincidence, which I thought was kind of funny. But the dentist at that time knew I was a hygienist and again was seeing a lot of patients struggling with a lot of myofunctional disorders and recommended that I look into myofunctional therapy as, like kind of a career shift. At that time, I had a 2-year-old and a newborn baby, and I was like, you're crazy. I don't have time for that. Not going to happen. But it was just one of those things that kind of sat at the back of my brain. I just continued to think about it. It would come up. I would be scrolling through social media or I'd be reading a hygiene magazine. And it was just right there in my face. And I took that as a sign to maybe look into it a little bit further. I just started taking some CE in airway and myofunctional therapy. And I was like, holy cow, those are all things that I dealt with as a child, like this and this and this. So I got into it because of my daughter and I stayed in it because of me and all the things that I went through and hoping to prevent that in the future generations.
So, suppose someone is graduated from hygiene school, they have maybe a year or so under their belt.
Mm-hmm.
How do they go about getting training for that?
There are several entities that offer certification. I personally went through the IAOM, which is the International Association for Orofacial Myology, where you can get certified as a certified orofacial myologist. You can also go, there's the QOM, there's MFT, there's different governing boards that offer certification. There unfortunately is no centralized governing body over myofunctional therapist, which I think is a lot of the reason that it's seen as like a hokey or alternative or hippie type of treatment, because there isn't just one place that you can go to get certified or one governing body that oversees all orofacial myologists. But it is still a very beneficial treatment or modality of treatment for a lot of people. So,
Okay. And about how long is the training for that?
it depends. So you can take like a weekend crash course where there is some self-study prior to that course, and then it would be like a 3-day intensive training. There are also programs that offer it via like a 12-week program. So it doesn't take a super long amount of time. I would say the most amount of learning is after you finish the program, because you finish the program and you basically don't know what you're doing. So you have to
Yeah.
learn by typically overseeing another orofacial myologist, or shadowing, or working as an associate for another orofacial myologist, where you can really get some hands-on training, see some patients.
That's really cool. I don't know, because I think about this as like a potential career for me.
Mm-hmm.
But one thing is like, where do you practice? Are you in a dental office, or do you have your own private practice that you do this?
Yeah, I do have my own private practice. I started in April of 2022, and at the time, I I had just quit my hygiene job, or was planning to quit my hygiene job, I guess, and stay home more with my kids and start the business kind of on the side. So I did start very part-time. It was 2 afternoons a week that I was seeing patients. I sought out employment. I wasn't really excited about owning a private practice. I didn't really want to go that route, but when I met with other dentists in the area, um, it was one of those things where they're like, yeah, we would love to hire you on as staff, but we don't know how we would, fill your schedule or pay you and those kinds of things. It would be easier if you were your own entity and we could just help you out. So that's kind of the route that I went. I do rent office space from a dentist. So I am inside a dentist office, but I'm completely separate from her. But it works really well because we see a lot of the same patients. So
That's cool.
yeah.
And so you make a lot of contact, a lot of like networking with other dental offices, then it sounds like.
Yeah. So I work with not just that dentist's patients, but I work in a city of 50,000. It's not very big. Pretty much every dentist office knows who I am, and they can refer patients as necessary. So
Nice.
yeah.
So something that I've seen on social media over the past few years is something called mewing. Is that related at all to myofunctional therapy?
I'm going to say yes and no. So mewing is basically the practice of practicing proper tongue posture. So keeping the tongue in that light suction, tip, middle, and base up against the roof of the mouth. Proper tongue posture has so many benefits as far as aiding in that airway function. Also, in childhood and through that, adolescent age, we are still growing this craniofacial structure, and that proper tongue posture aids in that natural palatal growth and development. So our tongue, is our natural palatal expander, and our lips and our cheeks are our face's natural braces. So if we have those muscles all in balance, we can grow the perfect palatal shape, get all those teeth in there without any malocclusion, crooked teeth, those kinds of things, and airway dysfunction.
Someone who is seeking myofunctional therapy, is it better that they're younger, or if they're older, is that okay too?
Yeah, so ideally we're growing this palatal shape in the early toddler years, so like 2 to 4 years old. However, we can't really get a 2-year-old to participate in traditional myofunctional therapy. They would more be looking into oral motor therapy with either occupational therapist or a speech language pathologist. We can start like a true myo program on a 4-year-old, so they can sit and they can process what we're asking of them. They can replicate the motions that we're needing them to do, and usually complete a home program as well, because myofunctional therapy is largely compliance based. You can't just come to therapy once every couple of weeks and expect progress. It does have to be done at home as well. So we can't really expect that of a 2 or 3-year-old, but we can starting at age 4. I would say the earlier the better. But the earlier the harder, if that makes sense. It's a lot harder to work with a 4-year-old as opposed to like an 8, 9, 10-year old. And I do still see a lot of positive results and changes in my adult patients as well. So I've seen patients in their 40s, 50s, 60s. I think I've even seen patients in their 70s make progress and have positive improvement. So it's not just for one age group. There's all age groups can benefit. I would say the most benefit can come when we start a lot earlier, just because we can influence a lot more of that palatal growth and development on the younger children.
Yeah, and I've been watching your TikToks for a while now, and I've been seeing the different exercises. And so, like the suction cup with on the roof of the mouth, I've been practicing that.
Hmm.
So it's definitely something I guess you could kind of get started on your own. But how important is it to have someone that's actually trained in this to guide you?
It depends on what kind of symptoms you're having. So if it is something to where I get a lot of comments saying I can't do that, or I've been trying this for a long time and I can't get the back of my tongue up at the roof of the mouth. So in that situation, we would maybe be wanting to evaluate tongue range of motion. Sometimes we are looking at that tongue restriction or a tongue tie preventing that optimal oral function. And sometimes it's just a matter of we've had these muscle patterns for a certain amount of time. So, say like 20, 30 years. It's not like those muscle patterns are just going to change overnight. So, I do think it's important to have someone guiding you along that process, depending on where you're getting stuck at, if that makes sense.
Yeah.
Hmm.
And so, if someone were to start doing myofunctional therapy,
Hmm.
how long do you think it takes to see results, and just overall?
Yeah, so that's a good question. Typically, in that 6 to 8 week range is where we start to see improvement. In that 6 to 8 month range is where we see that more neuroplasticity to where we have those new muscle patterns formed. It's more like instead of going to the gym and lifting a bunch of weights, once you stop going to the gym, we lose all that strength type of thing. So, what we're doing in therapy is more teaching someone how to ride a bike. It's not like you learn how to ride a bike and forget how to ride that bike. We want to teach our muscles how to work in a way to where they just do what they're supposed to be doing when we are not thinking about it.
And so, I know one question that a lot of people will have is, money. How does it compare to being a dental hygienist?
Well, the first year in business, I recorded a loss. The second year in business, I did turn a profit, but it wasn't very much of one. I did pay a lot of it in taxes, and then the rest of it I paid in childcare. Um, I think going forward, I do expect to make more than my hygiene salary. So it does take a
Oh,
couple of
awesome.
years to build your client base and your reputation and get the word out there as far as if it's a newer modality of treatment in your community. So for me personally, I am the only myofunctional therapist in my area. And so it was a matter of getting providers educated on who I am and what I do and how I help people and how I can help their patients. Um, and that took some time. It took a long time. But if you're in a more established area, typically on the coast is more up to date on those types of things, um, and more familiar with myofunctional therapy. So it maybe would take a little bit less time to get your name out there and start, building a client base. But yeah, a couple of years for me is what it took.
Okay. And so, when you're meeting with a dentist for the first time, they haven't heard of myofunctional therapy. What is their reaction to this new thing?
In my experience, in the Midwest, it's a little bit harder, which is where I am in the Midwest, because it feels to me like providers in this area um, have the mentality more of like, well, we've always done it this way, which doesn't really serve their patients best because medicine is always evolving. There's always new research and new technologies and better ways to serve our patients. So I do get that reaction a lot, though. Like, this is so silly and no, thank you. Um, so I probably won't ever get referrals from certain providers in my area, but I think the more and more providers see what benefit you provide to their patients, the more likely they are to refer patients to you. So it's a
So, in
hill
that,
I'm willing to die on. So
yeah. Would you say that when you're talking with a dentist, does it help to have like concrete evidence or like statistics, something like that?
yeah, research always helps. And there is more and more emerging research every single year supporting myofunctional therapy as, a modality of treatment, especially in the world of sleep apnea and tongue ties. So I think, in the years to come, it's going to be easier and easier, but I hope anyway.
Yeah. So one thing I've heard about too is there's kind of this opposing force from ear, nose, and throat specialists, because I know myofunctional therapy is more like, work your muscles, train up for that, where they're more like, let's just slice them and dice them.
Mm-hmm.
So what have you noticed in that world?
I've gotten some patients actually to where that was the recommendation from the ENT and they weren't wanting to go that route, or the ENT said, well, there's basically nothing else that we can do. And then they've come to me and had great improvements. So, I've also had oral surgeons say that it's kind of silly and not worth their time. And then I've sent a patient back to them making huge improvements in range of motion and those kinds of things. And like, what have you been doing? Like, oh, I've been doing myofunctional therapy. And they're like, oh. um, Honestly, it just is hit or miss because a lot of ENTs are really great at keeping up on this kind of research. I've taken a lot of training through the Breathe Institute, which is largely comprised of Dr. Saroo Zaghi, who is an ENT. So I think he is a pioneer in that area. Typically, if you meet with an ENT and they say this is so bogus, you can say, well, this ENT doesn't think so. And
Yeah.
that maybe helps at least get the seed planted so that they can look into it on their own.
Yeah, that's good to know someone who's credible and also believes in myofunctional therapy.
Yeah. He's actually published a ton of research surrounding myofunctional therapy. So
Yeah, I've heard of him before. His name is definitely prominent in that world.
Mm-hmm.
So
yes.
yeah, I mean, that's all the questions I really have. Is there anything else you wanted to share about myofunctional therapy? I know it's a very broad question.
Dental providers, I think it's always important to, even if you're not wanting to specialize in myofunctional therapy as a hygienist, I think it's still important to know what to look for as far as like deficits in your patients or potential patients that could benefit from myofunctional therapy. As a hygienist, I never was looking at that type of thing because in hygiene school, all of the things that we look at were seen as like anomalies or something that is normal. But I would be looking at patients who have like linea alba in their cheeks, or they have a lot of occlusal wear, they're clenching and grinding their teeth, they have a high vaulted palate. Those are kinds of things that are red flags as far as airway health. I do also think it's important to be looking or asking questions about how the patient is sleeping and digging a little bit deeper as far as that goes. Noticing if the patient has really dry, cracked lips, if they tend to breathe through their mouth, if they have a lot of that redness in their upper front teeth and their gums, signifying that they maybe are breathing through their mouth a little bit more than normal. Those are important things to look at as far as dental hygiene goes, and things that I never looked at until I became a myofunctional therapist. And I was like, man, I really wish I would have noticed that sooner on my patients.
One thing that I do remember is that poor airway health can also lead to like higher rates of periodontal disease and higher rates of caries. So, I mean, just for that alone, I think that should be motivation for hygienists to be looking into it.
Mm-hmm.
I have heard also that there's a lot of people that think myofunctional therapy should be a part of being a dental hygienist because as their provider, we're already in their mouth. We're already looking at the same areas. So even if you're not the one to treat them, at least you can identify a problem and say, hey, you should go see Kayla, for example, and say, she's going to help you breathe better.
Right. Yeah, for sure. There's a lot of things. And once you know what you're looking for, you can't really unsee it. So there's a lot of things that I just completely dismissed for the whole entire time that I was working in private practice. And I think about some of those patients like, man, I wonder what we could have, what benefits we could have made just by a simple referral to a myofunctional therapist. So
That's awesome. So where can people find you online?
I find I'm mostly on TikTok, so I post the most there. I'm at Prairieland Myo. I'm the same place on Instagram, and my website is prairielandmyo.com. So,
Awesome. And then another question. So, um, when people want to find a myofunctional therapist, is this done in person? Is this done online? How does that work?
yeah, so I'm both. Some therapists only see patients in person. Some therapists only see patients virtually, and some do both. So I'm kind of a hybrid. I do see the majority of my patients in person in my private practice, my brick and mortar up in the city that I practice in. But I do see about a third of my patients virtually. They usually are finding me through social media, so Instagram or TikTok. Um, they maybe feel like they can trust me a little bit better because they've gotten to know me a little bit on my TikTok, or they are somebody that doesn't have access to a myofunctional therapist in wherever they live. So it's a great
Nice.
option for people in that situation to where they don't have access to somebody locally. Maybe their closest therapist is like 3 or 4 hours away, and that's just not sustainable to make it there. I do also have patients that do have somebody locally, but work a lot or travel for work, and it just doesn't make sense for them to be seeing somebody locally when they're not there. So they just see me on the road. So,
Okay.
yeah.
Well, that's cool. I want to thank you so much for being on the show and
Yeah,
taking
thanks
the
for
time
having
out of
me.
your
It's
day
fun.
to share with us about myofunctional therapy. It's something I'm definitely passionate about and hope to learn about it in the future. So thanks for giving us a little bit more insight.
Yeah, you're welcome. Thanks for having me.
Thank you for listening to this episode. If you enjoyed this podcast, please leave a 5-star review. It is so helpful to get this podcast out there and to be seen by more people. Another way to support the podcast is to share this episode with someone who just started hygiene school or is considering it. Either way is helpful. As well, I'm going to leave a link in the show notes that allows you to leave me a voicemail. I would love to hear from you, and you can ask me a question, or if you just want to comment about the podcast, that would be great. I might even share it on a future episode. Thank you so much, dental nerds. Until next time, I'm Dach Ska.